it's functional and you don't have to wear it forever. But they're designed this way for a specific reason. So talk to your doc, make sure you understand what's coming your way.
Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita, board certified plastic surgeon in New Jersey, and I've got my dear friend and co-host, Dr. Ashley Amalfi, up in Rochester. And hi girl.
Hi Smita, welcome to Show and Tell.
I know, we are doing our whole series. It's a show and tell series, guys. This is our second episode and we're talking about bras. Oftentimes, if our patients have breast augmentations or lifts or even removal of implants, we can put you all in surgical bras. And sometimes those bras vary based on what we're doing. So we're going to do a little show and tell so that you guys have all the information to have a successful recovery.
All right, I'm the unboxer or whatever you want to call it.
Yeah. It's a plastic surgery unboxing, guys.
Yes. This is not as exciting as like a Gucci bag, but here we go. So this is a compression bra. So a compression bra is just like a very intense sports bra, I would say. This is a larger size, but it is adjustable, big, and wide. So the things that you'll notice about a surgical bra is it zips or clips down the front. This one has a zipper. Some of them have clips. That's because it's hard to put your hands over your head. And remember, you're going to wake up in this garment, so it's easier for us to put it on when you're laying down, right? Shoulder strap. So this one has adjustable shoulder straps so that we can kind of adjust if it's feeling too tight or adjust to your body size. And then I would say the other thing, Smita, that I think is important when you're doing more of a compression bra is you want to compress the armpit too. So for a lot of these bigger reductions, we'll do some armpit liposuction. And if you wear a skinny bra strap, then your armpit is going to bulge. So I would say those are kind of all the things that are interesting and unique about this kind of surgical garment. I mean, this is not that cute to hold up. I mean, this is not.
It's not. It's not cute at all. I mean, frankly, guys, the surgical bras are not cute, period.
No,
no. It's just to get you through those first couple of days until you're ready to swap them all out for sports bras or something else.
Exactly. Who do you put, Smita, in like these thicker kind of real compression bras? What kind of cases do you do that you would use that?
Yeah, I mean, so the breast reductions, like you mentioned, even if I'm not doing a breast reduction, but I'm doing breast surgery, but I'm doing a lot of liposuction, the sides, the chest wall, the bra bulge, sometimes even the upper back. You know, a lot of people have those little like rolls like that just hang out of your bra. Those are good because it adds enough compression there, you know, when you just put in some ABD pads. But when I take out implants, if people want to do a X-plan with a mastopexy or a breast lift, then I'll use something a little bit more compressive like that.
It's really, it reduces swelling better, essentially. So in all the things Smita was talking about, like liposuction or really complex breast surgeries, we want to keep things tight and compact and prevent some of that inflammation and swelling. And that's what the compression bra is good for. It's a compression bra, so it's not like soft, stretchy, and comfortable. It's going to feel kind of tight, and that's the point. But it's going to help compress in all the right areas, and they're usually slightly adjustable. So if it's bothering you, look at how you can adjust it, or call your doc and see if you can adjust it a little bit, because you don't want to be in pain from these things, but also, you know, it's not the coziest thing that you ever wore.
I mean, that's the thing too. I mean, you guys should be able to breathe when you wear them. I think some people think that it's so tight, and then you come in with little marks on your skin because it's so tight. So no, it should be compressive, but it shouldn't like be so compressive that you can't breathe, you can't move, you're digging into your skin.
Yes, I don't want.
We don't want that. So it should just provide a little bit of extra support.
We don't want you to have like ulcerations or cuts or anything like that. And sometimes you can put little gauze under those areas if it seems to be digging in a certain spot. But a more comfortable bra that is a surgical bra still is just a standard surgical bra that does not have compression. And I use those more for breast augmentation patients when I'm not too worried about swelling. So a similar kind of bra, this one has little clips in the middle, like little hooks and eyes, just like the other one had the zipper. But you can see that this has like a thinner strap. It's a prettier, softer, stretchy material. So it's not as thick, as big, as vest-like as the compression bra. This is something I would use for a small lift where I'm not worried about a lot of swelling, and most often for breast augmentation, just a primary breast augmentation without liposuction.
Yeah, no, I do the same thing. That is, I would say I use the normal surgical bras probably 95% of the time.
Yes.
Just because they're a little bit, I don't want to put so much compression, especially on the nipple, that it's cutting off blood supply, right? When we do these big lifts, especially a lift with an implant. And so I just want support. So the surgical bras do great with that. And also, obviously for breast augmentation as well. So, and they can all look different, right? I mean, some of them are white, some of them are more like bandeau type, like almost elastic, like a bra band. It depends on the hospital and the surgery center and, where your surgeon operates and what supplies they have. But these are the majority of the time is what they look like.
This gives you a good general idea. You can certainly ask your surgeon what those are going to look like ahead of time. And then remember, if you're buying ones to transition to, that front closure is really the most important part because it's just so much easier to put it on if it clips or zips in the front, because putting your arms over your head is going to be a little bit tough at first. But remember, this is not a fashion statement. It's functional and you don't have to wear it forever. But they're designed this way for a specific reason. So talk to your doc, make sure you understand what's coming your way. And if it's bothering you, please speak up and reach out, and we will make sure that you are comfortable in your garment and that it is doing its job.
Exactly. The other thing that I always tell people is some of the material for the bras can be a little scratchy. Even the normal surgical bra, it's thinner and it's softer, but it can sort of it feels weird on the skin. So sometimes I'll tell patients, if the bra is bothering you, wear a tank top or something underneath and put the bra over it.
Yep, that's a good idea.
Same thing with other, binders and things like that. It just gives you a little extra cushion, but the bra is still doing what it needs to be doing.
Yeah, this stuff is thick, guys. It's not Lululemon. It is thick and it is doing a job. But we have lots of little tips and tricks, so that's an awesome one. Well, that's easy. You guys know what to do. Ask your doc about when it's time to change out of these surgical bras and into your own sports bra. And it's going to vary from patient to patient and surgery to surgery, but not a lot to worry about here.
All right, this was awesome. Come back, guys. We have a whole new series. We're going to be showing you guys all of the devices, the compression, the this and that, all the stuff that we could talk about in the office, but we never really have a chance to show you, and then you just wake up in surgery with it. So now you get a glimpse into all of that beforehand. So make sure you do come back and see us next week, Lipstick and Lipo.
All right, see you guys soon.
See you later. Bye.